I had heard all these amazing things about Cuba, but had never ever had the opportunity of going. So when the opportunity came, I was very excited that I was going to learn something new, something from a Latin American country, something from a country that's doing things different.
When I saw with such little resources, the fabulous things that they were able to do, I just thought about it and said, okay, I know even though my community is deemed the poorest congressional district in the United States, we have resources. I've learned that in Cuba and I brought it back to the Bronx.
With the MEDICC trips, we were able to meet people sometimes in our own community that we really hadn't been working with. We really had the ability to work together in a way that we wouldn't have had we just gone to meetings and met people in a more formal setting and without that inspiration of Cuba behind us.
Cuba's approach can absolutely and fundamentally change how the U.S. approaches healthcare.
Castro said, we will give a free medical education to anybody who qualifies, who will come to Cuba, to ILAM, provided they will agree to go back and serve in shortage areas.
Academically, ILAM is tough. Students treat the whole patient, mind and body, in the context of their families, their communities, and their culture. They learn public health to assess their patients' drinking water, housing, social and economic conditions. And finally, they're taught over and over again the importance of prevention, especially as chronic diseases cripple health systems worldwide.
Here at home, with the immense resources that we know are available, the scarcity of services just doesn't seem to add up. And when you tell me that it's not possible to provide high-quality services at low cost, well, I know that that's simply not true. I know that that's not true because not only have I seen it work, but I've done the work.
Receiving this gift from a country who already does not have a lot, there's no way that I'm going to return back to the United States and just take any job. You know, I want to be able to give myself to the very communities who are underserved and be able to serve them and provide these services for people who normally would not have such access.
There's a tremendous amount that we can learn from Cuba. What MEDICC has done very well is provided U.S. policymakers with clear examples on why we should have common ground. We know as members of the House, those of us that are very interested in fostering better relations between the United States and Cuba, that we can rely on MEDICC for very sound information about the healthcare system.
MEDICC review is important because many in the U.S. medical community and policymakers have now been exposed to Cuban best practices, perspectives, and innovations that they would never have seen otherwise.
Back now with hopeful news for the 21 million Americans diagnosed with diabetes. It comes in the form of a drug made in Cuba that's now used in more than 24 other countries, but not here in the U.S. Doctors are hoping the recent diplomatic breakthroughs will make it possible that that drug can come to America.
President Castro and I announced that the United States and Cuba would begin a process to normalize relations between our countries. We've begun initiatives to cooperate on health.
When President Obama opened relations with Cuba, MEDICC was right there on the front lines. Now, many of us are not sure where our foreign policy is going these days. However, having said that, it should be the direction that this country goes.